Hi guys, today we will be talking about a historical topic that I'm very interested in, plague doctors and medieval surgeries. Let's start with the former. Plague doctors were physicians who treated those suffering with the bubonic plague, specifically in Europe in the 17th century. Plague doctors wore a very notable uniform. First off, they wore a long wax coat that reached the floor and fell to the wrists on the arms. This was designed to prevent the spread of airborne diseases. The most eye-catching thing that they wore was a beaked mask with glass eye openings. Many people find this an interesting uniform. The beak contained aromatic herbs and flowers. An example of these flowers could be lavender, mint, cloves, or myrrh. It was thought that the scent would be able to prevent the wearer from bad air, which was what was believed to have caused the plague. We now call this miasma. Leather gloves were worn to protect the physician from direct contact with infected individuals or materials. A wide-brimmed hat, often made of leather, was also worn to protect the top of the head and the neck. Leather boots were worn to protect the feet. Underneath all this, plague doctors would wear a thin white blouse with short sleeves, serving as a modern-day shirt. Shirts, with a long bottom, were always tucked into the pants to prevent things dragging on the floor and therefore being indirectly infected. Nothing about this outfit was for style, but nonetheless, the physician commanded respect. Many physicians also carried a sort of stick/cane, which was used to move patients without direct contact. Many people see this as rude and harmful to the patient, and it is often less noted. The entire purpose of this costume was to create a barrier as big as possible between the doctor and the patient. Medieval doctors had few methods for treating illnesses. The most well-known procedure was bloodletting. Trigger warning, I will be speaking about blood, blades and sharp objects. Bloodletting is the deliberate withdrawal of blood from a patient's body to prevent or cure diseases. This was achieved with a blade and a bowl of warm water, or sometimes leeches. Bloodletting specifically was done if the doctor thought that the patient's body was too warm and moist, and as blood is warm and moist, it must be removed from the person. Another method, used specifically for the bubonic plague, was lancing. I will give you all a warning now, this might get a bit nasty. First of all, bubobes are swollen lymph nodes that can appear anywhere on the body, but most specifically under the armpit and on the groin. They are characterized with the Black Death. The bubobes were filled with pus. They start off a dark purple colour and then turn black. Lancing bubobes was the practice of draining pus and other bodily fluids from swollen lymph nodes and bubobes. As one can imagine, this was incredibly painful and pretty ineffective. The opening of the wound led to secondary infections and often sped up the process of death due to the spread of bacteria. A very interesting method used in the Middle Ages was trepanation. This was a technique of drilling or cutting a hole into the skull. The brain was not touched at all during this procedure. It was carried out to alleviate pressure on the brain following an injury to the head. Another reason this system would be carried out was due to mental illness. People in the Middle Ages, of course, did not have an understanding of mental illnesses. It was thought at the time that things such as depression, anxiety, or OCD were caused by the devil. The only way to stop this would be to drill a hole into the skull in order to let the devil and any other evil spirits out. This was not a one-and-done procedure. Many people lived their lives with 2 or 3 holes in their skulls, having accumulated them over a number of decades. The survival rate of trepanation is 91%, and it is still performed in some countries today. Some doctors thought that burning herbs, applying poultices, and ingesting toxic chemicals such as mercury would do the job to cure a patient. I think we know how this turned out. Plague physicians often relied on the sky and the positioning of the moon rather than a textbook. This is something that would terrify the modern-day doctor. Plague doctors liked balance. They wanted all the planets in their exact and well-known order. Specifically, they wanted the same amount of blood and limbs on each side of the body. Modifications were often made if things weren't matching up. For example, if you were missing your left index finger, it would probably balance things out if you lose your right one too. In modern day terms, many people get a plague doctor tattoo as they now symbolise taking care of someone special, for example, looking after a family member for many years who unfortunately passed away, and the tattoo is to commemorate them. Unfortunately, the first successful form of anaesthesia was invented in 1846. Findings were not publicised until 1849. The people of the Middle Ages found other ways to cope with the pain during surgery. The most common method was to simply gut through it, squeeze the hand of your best friend and pray that you go unconscious from the pain. People often had to be strapped down for surgery, as kicking and screaming was not very conducive for focus. Most people were given a stick or a bit of leather to bite down on in hopes that this would control the pain to some extent. Many surgeons relied on natural remedies, such as hemlock, mandrake, and opium. These were used as sedatives to dull the pain, but it was often ineffective, toxic, and altogether very dangerous. Contrary to popular belief, the most important thing to worry about after surgery was not the possible lost limb, but rather possible infection from unsterilised tools and bacteria. Unlike today, the medieval era only had one kind of surgeon to offer: the barber surgeon. It is exactly what you were thinking. They would cut your hair and your limbs. This is where the white and red striped barber pole comes from. The white represents the haircut and the red represents blood. Specifically, the white represents teeth and the extraction of them. Barber surgeons were skilled in treating wounds and setting broken bones, but their techniques were often harsh and unsanitary. Barber surgeons took care of tasks that today are distinctly separated, such as cutting hair, shaving, and medical treatments, such as bloodletting, tooth extraction, and even amputations. They were a necessity in the healthcare system, especially during wartime, when they were crucial for treating soldiers. Unlike today, their training did not involve university of any kind. It was much more hands-on, learning from experience, such as an apprenticeship. Barber surgeons had a small range of tools, 3 to be exact: razors for shaving or pulling back skin, knives for removing beard hair and limbs, and a scalpel for extracting teeth and... let's not get into that. One of the most well-known barber surgeons is Ambrose Pare. As one can guess by the name, he was French. He discovered something that would seem obvious to modern-day humans. Pare's older brother was a barber surgeon, and that is how he got into the trade. He served 20 years in the French army as a surgeon. Before Pare, wounds were treated by pouring boiling oil directly into the afflicted area. To stop the bleeding and the release of other bodily fluids, they were cauterized. This meant that they were sealed with a red-hot iron. The definition of cauterization is to burn the flesh with a heated instrument in order to close the wound. It was revolutionary at the time, the 1500s to be exact, that Pare discovered that treating wounds with a mixture of egg yolk, oil, roses, and turpentine helped the wound to heal faster than the previously used method, which was simply pouring boiling water on the inflicted skin. Pare did invent something much more influential: a ligature. During amputations, instead of cauterizing, he used ligatures, for example, silk threads, to tie blood vessels. If you are unsure, the exact definition for a ligature is something used for tying or binding something tightly. We can see how this would be very useful for surgery. Unfortunately, ligatures could not fix everything. Hygiene was not as prevalent in the 1500s, and the patients were given contaminated thread many times. Dirty surgeons' hands did not help. If you were from a poor town in the Middle Ages, and you did not have a barber, you may have had to rely on your local butcher, as they knew how to cut meat and possessed the necessary tools to do so. You just have to hope that they had good aim. Surgeons stopped being barbers or butchers, or simply having 2 jobs in general, in 1745. The 2 jobs were distinctly separated, and each given their own shops. They did not mix again. That's all the history I have for today. Thank you so much for listening. I really appreciate it. I hope you enjoyed this story. Please let me know in the comment section down below what other historical stories you would like to hear, and anything you think I could change about these videos to improve them. I got the information for this video from various websites on Google, not Wikipedia, I promise. I also searched a bunch of YouTube videos and looked through various history textbooks. If this was a good mix, make sure to let me know. Thank you so much for your time. I hope you enjoyed it. If you have been listening this long, comment a heart emoji, this one specifically. I hope you will have a wonderful evening. Look out for the stars. Bye!